Excellent. So this is now recording. So welcome to the Pharmacy Foundations online revision course 2022-2023. This is the feedback session for law ethics, and we're predominantly also going to be talking about exam prep. So what kind of things can you be doing just to help ensure that you are ready for the exam at the end of the month? These are all the topics that we've done, a large range of topics. Thank you so much for everybody that's been along with us for this journey over the last 10 months or so. It's been really great to have you on board. Hopefully you've been enjoying the content and assuming that some of the names I notice that turn up every month, and I can see who's viewed the videos month on month as well from the back end of the website. It's great to see that you guys have been engaging. Hopefully you've been learning lots and lots, hence you've been choosing to engage every month. But thank you so much for your attention um, and supporting the company as well, of course. So just a brief background for anybody that's not aware of the company already. In terms of the training that we do, we are targeting, in essence, you could say, even undergraduates, foundation pharmacists, which is yourselves, as well as postgraduates, to be fair with you. It's a large variety of things that we do. We do some charitable work as well with the UK BPA, the Black Pharmacists Association. This is just to help lessen the attainment gap, where unfortunately, statistically speaking, Black students are more likely to fail the GPHC assessment. So what we do is we sponsor maybe, I believe it's 6 or 7 trainees on our courses, and we also get mentors in for them. So these are outside of their workplace mentors, just to help guide them really through the foundation training year. So that's when you guys support us, that enables us to be able to do things like that. So thank you so much for your due care and attention, really, and supporting the company, to be fair with you. Some of the other things that we do as well, we do a variety of things such as GP clinical simulation and helping universities implement that into their curriculum. Advanced clinical assessment skills. We're actually going down to London. One of the universities there has hired us for a couple of days to do some teaching on advanced clinical examinations. This is something that I do quite regularly. So before I set the recording off, I told you guys that I was on call on Friday in general practice. So I work as an advanced clinical practitioner, predominantly see minor ailments, acute presentations, and infrequently long-term diseases as well. In terms of long-term diseases, I have a particular interest in the management of asthma and reducing cardiovascular risk. That's me pretty much in a nutshell. I mean, previous roles I've had, I've worked as your locum in community pharmacy, although I'd say I'm very sheepish in terms of community pharmacy at the moment, from the aspect of the paperwork, really. I've not worked in community pharmacy for several years now. However, I've worked there before. I've also been a superintendent for an online pharmacy, so I do have a broad range of experience and skills, and hopefully we'll try and bring them out today to help your learning experience. In terms of Pharmacy Foundations, then, there's several social media pages, but there's actually a YouTube page as well where these videos and other videos are uploaded where you may benefit from having a look at them. I always think that I generally tend to used to listen to the radios, current affairs, kind of keeping up with things. However, I've kind of switched to podcasts now. We do have a podcast as well that's available if you want to listen to that. However, if you want to play the videos and just listen to the audio, obviously do keep your eyes on the road in case you are driving. But if you're using public transport, of course, you can feel free to watch the videos. And I think the beneficial thing is on YouTube these days, you can watch at, I think, 1.5 or 2x on the videos as well. You kind of probably have me sounding a bit like a mouse, but nevertheless, if you can get the information twice as quick, why not? As long as you can pick everything up. So that'll probably be useful for your commuting journeys. I think I do personally think the Instagram's really, really useful. There's lots and lots and lots of content that's been uploaded now. Literally, I think we're in the hundreds of posts where you can literally just look, open something up, and then there's a revision tip there for you. And it can be quite useful and beneficial, I think, between if you're in community pharmacy, between serving patients or between dispensing prescriptions, just to have a quick look over and just picking up little nuggets of information, really, because you never quite know what can really come up in the exam. I assume a lot of the people on the call today already have this link and are already part of the WhatsApp group. However, for anybody that's watching the video later, that's not, feel free to scan this if you're a 2022 starter. There'll obviously be a new link for students that are going to join from 2023. So then let's crack on and dive straight in then. So in terms of the law and ethics session, well, what was the content? Let's try to summarize everything. So for anybody that's not accessed the session, just so you get a bit of a flavor, and for anybody that has, hopefully it's a bit of a refresher. So we looked at law and ethics and with regards to the registration assessment framework, and we discussed how about 10% of questions are miscellaneous, you could say, within the exam and may come up as law and ethics based type questions. Okay, so that's something really, really important to be aware of. So 10% of all questions, if you think about predominantly, it's going to be in paper 2, of course. So that'll be 12 questions potentially, and we all know people that unfortunately have failed in the prior years by 1 or 2 marks. And I do feel that law and ethics is kind of like the low-hanging fruit of this exam, where it's simply systematic recall, and being able to recall pieces and factoids, you could even say, is going to help you gain marks. So it's definitely what I'd consider low-hanging fruit in comparison to somebody like saying the cardiovascular system as a general topic. Significantly more challenging than law and ethics. So therefore, if you can get marks from easier sections per se, please do make sure you're picking them up. We also discussed resources to use to review for the law and ethics section of the exam. So what's the most common resource that we've all used to revise for law and ethics? What's the most obvious one that you can think of? Anybody in the chat? MEP, exactly right. MEP is your go-to resource when it comes towards revising for law and ethics. I'm hoping by this point you've probably already revised. However, if you've not had a look through the MEP, please do make sure you have a look through it. Okay. Other things, that might be worthwhile just to be aware of. Okay. Just to be aware of things like the Human Medicines Regulations. So that was updated in 2012. We've got the Medicines Act, which was 1968. The Veterinary Medicines Regulations, 2013, and the Data Protection Act, which is incredibly important, as well as GDPR regulations. All of these kind of things, they are somewhat highlighted within the MEP, but if you've had a chance, have a very brief look over this. I wouldn't spend maybe more than 10, 15 minutes having a look around Google, just to try and summarize these really. Not something that you need to have a significant look over. However, it is useful to have a general awareness of these things. Now, other things that we discussed during the session was we did bite-sized medicines ethics and practice, what I would call it. Bite-sized in the sense that we broke down the predominant sections of the MEP. Anybody know what sections there are in the MEP that are the main ones per se? Any ideas? So the MEP, the first section, it's all about core concepts and skills. Following on, it's underpinning knowledge, and then following on from there, it's the responsible pharmacist regulations. And then towards the end, you also have the appendices, okay, as well as the standards as well, which comes slightly later on. Very, very important that you've had a look over these prior to your exam. Very important, okay? Like I said, guys, it's low-hanging fruit. This topic isn't challenging. It's not necessarily difficult. There is a lot to remember, but in comparison to how much you have to memorize for other topics, it's not necessarily as significant, okay? So case studies and lots of questions. That's something that we used in the last session for you to be able to kind of retain this knowledge. The thing is, when you get closer and closer to the exam, the mainstay of your revision kind of shifts. Hopefully by this point you've already made your notes and you've already read through your notes several times. Then the next thing to do is try and consume new content, right? Not necessarily new content per se, actually. It's more so the fact that you're consuming the same knowledge, but maybe in a different form. Okay, so for example, let's say, for argument's sake, you've purchased our cardiovascular system. You've made your own notes. You're happy, you're comfortable, but now you're getting a bit complacent. Well, the cardiovascular topic, having a read through that or having a listen to or watching the video is probably going to be quite useful to help try and keep yourself more engaged towards this exam. So similarly, how we structured this law and ethics session, it was with a significant amount of questions. I think there must have been about 40 questions in there with a few case studies as well. So it's really, really important that you shift your learning. What you want to be doing is more questions, more scenario discussions with your colleagues, and trying to consume the same information that you already know, but in different forms. So if it's maybe somebody else has made some flashcards, I'm sure there's lots of different resources out there that you can use, and it doesn't necessarily have to be from this company. These webinars, this particular webinar and all the feedback sessions are free to attend. So why not watch some of the other feedback sessions? Okay. So then let's move on and talk about the layout of today's session, just being a bit mindful of time because there's quite a few things I want to cover in terms of exam prep. So today, I'll have a look at the questions that you guys have emailed in and respond to them. We'll also revisit popular section from this law and ethics session, which I think you guys might benefit from. If you've got any questions, of course, in the chat, I'll try and answer them, hopefully as we're going along. And finally, I will talk about exam prep. What can you do at this stage to help ensure your success in the coming weeks? How does that sound? Good? Should we get going? Right, let's get going. So your questions that you guys have emailed in, can you talk about CD regulations, safe custody and prescription requirements? That's fine. I've extracted some slides and a case study as well from the session. So hopefully we'll cover that in a few slides to come. And how to revise at now till the exam. I think that's meant to say, somebody might have done a typo when they were messaging me, but how to revise now till the exam, in essence, the person's getting complacent. I've already made notes on everything and read them again and again. Yeah, so complacency is definitely something you want to avoid. Okay, you are running a marathon and you are in the last 500 meters, I would say, at this point. It's not a mile, so it's not a significant distance. The finish line's in sight. Complacency now can cost you the exam. Complacency now can be the difference between passing and failing, or just being one of them people that fails by a few marks. Okay, so don't become complacent at this stage. I've already discussed actually some of the things that you can do to avoid complacency in terms of consuming the same knowledge that you already know. One thing you definitely don't want to do is overburden yourself and start panicking and thinking, I don't know this, I don't know that, by in essence going too deep into things per se. Okay, this exam is preparing you for day one as a pharmacist. Okay, ultimately you can keep reading the BNF, you can keep reading very, very detailed notes and keep going into the absolute minutiae of anything. And then even in topics like law and ethics, you can spend absolutely weeks upon weeks. Okay, but the main things you need to think to yourself is, does a day one pharmacist need to know this? Yes or no? Okay, use that as your basis, use that as your foundation when you're revising. Okay, that doesn't mean knock out absolutely everything, because sometimes what a day one pharmacist has to know may be slightly more even than an experienced pharmacist per se in regards to particular topics. Okay, now me personally, I probably know significantly more in terms of diagnostics because that's my role, that's my job, isn't it? However, you might know slightly more in terms of a different aspect of pharmacy or medicine for that matter. Okay, but the main thing is, do not become complacent. Complacency, I feel, with students tends to come from two things. Okay, the first thing that makes you complacent is not appreciating how much you need to know. Okay, so not appreciating how much you need to know makes you very blasé. You think it'll be fine, I've got in the bag, I already know everything, I don't need to revise anymore. That's one type of person that becomes complacent. Okay. You definitely don't want to be that person. You want to understand how much you need to know. I'm going to talk about exam prep in a few slides to come. You'll understand how much you need to know, hopefully in a lot more detail. The other type of person that becomes complacent, I feel, is once a person that, well, I already know everything and they don't actually know what they need to know, so therefore they become complacent inadvertently. The other person is the person that's ahead and they've been through their notes again and again and again and again, right? They know the notes pretty much inside out, but they feel that they're not necessarily sticking. The reason for that is because you've gone over the thing so many times that you find it difficult to retain that information simply because you continually keep using the same approach. Okay? So what they say about insanity is doing the same thing again and again, expecting a different outcome. If you've read your notes, let's just say 6, 7, 8, 9 times on just on the cardiovascular system, which could be about maybe 10, 15, maybe 20 pages, and you've read them notes, let's just say 8 or 9 times, and they're still not sticking, what does that mean? What that means is your approach needs to change. Okay. It might mean making flashcards. It might mean making a spider diagram, whatever is going to work for you. Okay. What I would genuinely recommend is if I know some people, the idea of revision is literally making notes and continually reading them. What I would definitely start saying to do is if you're becoming complacent and you feel like the information is no longer sticking and you've been over it several times, is change your approach. Make some flashcards, make a mind map, get somebody to test you, colleague, a friend, a family member. Okay. That's the way that you're going to have to change. Otherwise, you're not going to have a different outcome in terms of retaining that knowledge. One thing that I find very, very useful, can be somewhat time consuming, is trying to remember a passage, highlight the keywords, okay? And it might be easy if you type this up per se, type this up on a Word document, in fact, and then delete some words, print it out and fill in the missing words. That'll genuinely help you remember significantly more amounts of information. Other things that you can do to prevent complacency is, for example, if you've not attended our cardiovascular session or our high weighted topics, at least I would highly, highly recommend at least going over them once. Okay. And if you've not had a chance to do that already, and you feel like you're getting complacent and you've been through your own notes several times, purchase a video, have a look through it. Okay. I've seen the feedback that you guys have sent through in regards to costing and pricings of videos. So we will amend them actually in the coming at the end of this session. Actually, I'll make an announcement. Just remind me towards the end, please, if I don't. Because ultimately we're here to support you. We want you to pass. We want you to get over that finish line. Things like this. If this free session helps, excellent, excellent. Hopefully the other free sessions have helped you as well. If you've just attended them, you don't have to purchase a course, but if you're at risk of complacency, then I would definitely say it's quite important to purchase a course, help frame yourself right, making sure that you're ready for that exam at the end of the month. Now then, the person that actually mentioned about CD regulations, they weren't sure of what's Schedule 2 and what's Schedule 3. Okay, what's really, really important is you have a look through the BNF or the MEP as well, for that matter, because it tells you actually what Schedule 2, what Schedule 3. But let's go through some very common Schedule 2 controlled drugs in the chat, guys. Name me anything that's Schedule 2. Any drug. Can we think of anything? I can think of a few. But what can you guys think of? What is a Schedule 2 controlled drug? Any examples? Anything that you've seen at work? We've got methadone. We've got morphine ampules. We've got MST. We've got morphine, ketamine. Anything else? What about oxycodone? What about fentanyl? All these are Schedule 2s, aren't they? Right? In reality, if somebody's going to ask you a question, if it's in regards to morphine, for example, well, there's two strengths, aren't there? The strength that's Schedule 5 and the strength that's Schedule 2. 20 milligrams per mil, I believe, is Scheduled 2. It's really high strength, obviously, 20 milligrams per mil. Think about that. Because if Zomorph is 10 milligrams, the lowest strength, and that's a Schedule 2, then surely the 20 milligrams per mil is as well. Okay, so that's important to know. With obviously with CD Schedule 2, you've got the record keeping requirements, and obviously of course the safe custody requirements as well. Okay, so let's move on to the example or the activity that I've extracted from the law and ethics session, which I think you might find beneficial. If you've attended the session already, please still participate. I'm sure it's going to be beneficial for your learning and your retainment of the information. So this activity was about underpinning knowledge. Have a look at the prescription. Let me know what problems there are. Let me know what issues there are. I want you to not press enter just yet on your messages. I want you to give yourself a minute or so. Have a look through, put all the issues on one message, and I want to see everything that's wrong with this prescription. And this will allow us to answer the question on the previous slide in regards to prescription requirements and so on and so forth. Right, hopefully you've had a chance to type up what you think is wrong with this prescription. So what's wrong with this prescription then, guys? So we've got one answer. Any other answers? Excellent, excellent. Correct, guys. So we definitely know that the prescription is expired, don't we? Because April was ages ago, right? So the prescription is expired because CD2 prescriptions expire after how long? How long do they last? 28 days. What about CD3? That's also 28 days, right? Good, good. So another thing that you guys mentioned is the dose is missing. It says take BD every 12 hours as directed. So that's not appropriate because we need some sort of number there, don't we? Is it 1 the patient's taking? Is it 2 the patient's taking? We know they're taking it every 12 hours. Fine, great. However, are they taking 1, 2, 3, 4? So that's definitely something that needs changing. Somebody said the total amount is not in words and figures. So we've got give 60, basically. So 60 also needs to be in words. Can that be added on by a pharmacist then? Would you be able to add that on, assuming this is obviously a green prescription? Yes, we can add that on, right? What about the dose? No, we can't change that, right? So that would go back to the prescriber for that one. And the date, of course, the date, of course, would have to also be changed by who? The prescriber, right? Or somebody from the general practice team, practically, considering the prescriber themselves might not be working that particular day, and the patient might need this medication urgently. So therefore, it might be somebody else in the general practice team that amends the date, sends the prescription back, or they might just create a new prescription. Understandably, we're in the age of technology where EPS prevents many issues and problems from arising. So realistically, a lot of these issues wouldn't typically arise necessarily anyway. However, it is important, obviously, for you guys to be aware of it for your exam. We've got other things as well that we could have identified as very, very minor issues, definitely not legal issues, things such as the date of birth. That would probably be good practice, if anything, as well as the NHS number, another thing that I think would come under the remit of good practice. Okay, not necessarily something that you even need to add on to the prescription. However, just important to be there when you're dispensing CD prescriptions. It's good to have as much information on there as possible, especially if it's private. Especially if it's private. So that might be somebody that's, for example, recently been released from prison per se, and they've got a prescription from there and they've brought it to your community pharmacy. Make sure there's as much detail on there as possible before dispensing it, because if there is errors and issues, or the patient's tried to pull a fast one per se, then you are on good footing. In terms of amending, we cannot amend the date. Okay, so that's what we were talking about currently. What you can amend is adding on the word 60 in words. Is that all right? So let's move on then to the next slide, where we will talk about some further examples to hopefully solidify an answer to this question that we had earlier. So this is a poster or one of the slides that we shared from the session. So CD Schedule 2s, we already know we've got opiates, we've got morphine here, but obviously we've spoken about other examples as well. The oxycodone, the fentanyl example that I mentioned to you guys earlier, CD Schedule 2, we know these have additional prescription requirements that we've discussed predominantly on the slide earlier. We've also got safe custody requirements, so these would need to be in a CD cabinet. Now, the other things such as emergency supply, that is not something that we can do. So if somebody does run out of Zomorph, for example, and it's Sunday, even though they've got a history of having it from your pharmacy, this isn't something that you'd be able to do. It would be illegal. We've also got the CD register that needs to be filled in for these, of course, and the RX, the prescription, is only valid for 28 days. In terms of the previous question, in terms of dosing, what dosing ultimately is going to come down to is the fact that if you've got enough information to be certain what the dose is, for example, if the prescription said it's 30 days treatments for argument's sake, and it's 60 capsules, well, then it would be a technical error. It wouldn't be a clinical omission per se. So that you could update. Obviously, you could get information from the patient. You could also ring up the general practice, just double check with them what dose did they want, and you could pop that on. If you don't have enough information, then obviously it'd be ideal to get the prescriber to do it. However, if they were to inform you over the phone, for instance, that'd be something that you'd be able to amend as well. Hopefully that makes sense. Now, next we've got CD Schedule 3s. Now, these are the minor stimulants and other drugs. So we've got phenobarbital, buprenorphine, temazepam. Now, these have prescription requirements. They do have some safe custody requirements, unless they're exempt. Now, emergency supply is not for these medicines. However, except for phenobarbital, specifically for the management of epilepsy, specifically, that specific example. Okay. The CD, they do not have a CD register, and the prescriptions are only valid for 28 days. So Schedule 4, this falls down to, of course, the benzodiazepines. We've got as well as the Part 1, Part 2. So this is the only controlled schedule, you could say, for that matter, that has two parts. So it's benzodiazepines and anabolic steroids, so anabolics. These don't have prescription requirements, don't have safe custody requirements, can be issued as emergency supplies, do not have a CD register. So the only difference between these and a normal prescription is the mere fact that the prescription just lasts 28 days. CD Schedule 5, that's basically CDs that contain codeine and low strength of morphine, so that's your oromorph. I'm not sure what the strength of oromorph is off the top of my head. Is it 10 in 5? I've got a feeling. So yeah, quite low strength. So that in essence is pretty much just as similar as a normal POM medicine. Okay. In regards to the question for clonazepam, I'll get back to you in the group. Always like to double check. I don't want to give you the wrong answer, so I'll double check and I'm going to get back in the WhatsApp group to you, Sonia. Hopefully that's okay. Let's go to the next one. Ketamine, actually, ketamine is, I believe, a Schedule 2. Let me double check that for you as well, okay? Because that falls under amphetamines, doesn't it? Like Lixtes amphetamine as well, kind of used sometimes in the management for ADHD. So that should be as well. That should be Schedule 2 as well. I will double check that for you though. I'll let you know hopefully by the end. Now then, let's move on to this question, where you are the responsible pharmacist and have a CD cabinet stocked full to its capacity. A patient has brought in some CDs for disposal and you decide to destroy these immediately. Which of the following control drugs does not require denaturing before disposal? That's correct. Yep, that's correct. Well done. So E is the correct answer. Testosterone. This does not require denaturing. Everything else you would need to denature. Okay. So hopefully that brings everything in regards to CDs, and CD requirements into order. And hopefully we know what's going on with them and we're happy with that as a topic, as a brief overview. Understandably, we've not gone into significant amounts of detail just during this very short seminar really, but hopefully that answers the question at least that was put forward. Let's move on to what's probably more important. So the second half that we've planned for, which is all about exam prep. So what can you do at this stage for exam prep? At the end of the day, we're only a few weeks away. Okay, it's a challenging year for you guys as foundation pharmacists. It's difficult. You've got the stresses of work. Many people haven't worked a full-time job prior to this point, and you've definitely not done full-time working in an exam season or so close to an exam. You've got that, you've got family commitments, you've got the absolutely fantastic weather that we've got outside, and understandably, nobody necessarily wants to be revising for an exam. Thankfully, the British summers are getting longer, so hopefully we'll continue to have a summer well into July, so you guys can enjoy the weather once the exam is done. But what's really, really important at this point is to avoid complacency. Now, what's incredibly important is for you as a student is to do a personal learning needs analysis. So what is it that you need to know? Okay, where is it that you have knowledge gaps? The only way that you're going to be able to define and draw a revision timetable, for instance, is by understanding your learning gaps. So for example, if I feel that I know the cardiovascular system inside out, it'd be nonsensical for me to say, well, I'm going to spend the same amount of time revising cardiovascular as I'm going to do for infections. It wouldn't make sense, would it? Because the fact of the matter is, even though they're both high weighted and they're both equally as important for this exam, if you already know a topic, don't necessarily lull and spend ages upon that topic. Move on to something that you don't necessarily know. Time is literally very, very precious. Generally in life, time is precious. Okay. But when you come towards an exam, it's incredibly important that you're using every hour, every minute, even really usefully, and using it appropriately to its maximum benefit. That's something that I've always tried to do. And generally, I've done quite well in exams. And the reason for that, I feel, is only really focusing my revision on things where I feel significantly weaker and prioritizing things where I feel weaker that are just as important. Now, understandably, what's also important in terms of prioritizing is understanding that, let's just say if you're weak on ocular medicines, okay, so you're not too sure about what dozolamide eye drops are used for, or you know, other carbonic anhydrase inhibitors, or what does that even mean really, okay, or what beta blockers are used in ocular medicines. If you don't know these things, but then you also don't know that there's another class of antibiotics that patients, if they're allergic to, penicillins, we should be cautious in using that class with them, right? What is that class, by the way, in the chat? What is that class of antibiotics? That if you are allergic to penicillins, we just need to be cautious in using that class with them patients as well. Does anybody know? I'm hoping this close to the exam that we are aware of this point. But if you don't know these type of things, okay, well then obviously it's more important to spend more time revising for infections than it is for the ocular section, understandably. Because the fact of the matter is infections covers a significantly larger portion of the exam in comparison to eye, right? Okay, and we've got the correct answer in the chat. So yeah, thank you for that. Cephalosporins, right? I think is it 5 to 6%, or is it between 4 to 6% of patients, somewhere along them lines, that they're gonna have, if they've had allergies to penicillins, they'll also have an allergy potentially to cephalosporins. Right. Now, ensure that your revision timetable, you're not using something absolutely generic, that it is more specific to your personal learning needs as well as your personal and professional commitments. Now, when I personally actually do have a timetable when it comes to exams, or when it comes close to giving in a coursework, and what I usually do is I put everything in there. I put in my 9 to 5. At this time I'm working. This is my commuting time. This is my return from work journey. This is my time where I have to go pick up my son, for example, from nursery. This is where I have to go do shopping or do the weekly shop, for example. When you do that, you start to realize where you do have gaps in your time, where you're potentially wasting time on TikTok or other social media platforms where you're not necessarily gaining anything for this exam, okay, and where you can, potentially put in some more time to revise. So really, really important that you draw up a timetable that's specific to your learning needs, and ensure that you cover all your learning needs and gaps, areas that you struggle with, and or areas that you need to recap. Now, if somebody said to me, I hardly know anything about several topics, and push is going to come to shove, there's certain things that I'm just not going to be able to revise before this exam, I would say definitely stick to your heavyweight topics. Make sure you know them as inside out as possible. Okay. For example, know the guidelines for hypertension, heart failure, ischemic heart disease, angina. Um, know the management of common infections. What's the management, first line management for, um, let's say, H. pylori, right? What's the management for a UTI in a patient with an EGFR of 16? What's the options to manage a UTI in pregnancy? What's the management for bacterial vaginosis? What's the management for thrush over the counter? What are the limitations for the management of that? If these are the types of questions that you can't answer, right? So these are questions that I've literally just come up with on the spot, you know. So if there's questions in there that you can't answer, well then maybe the infections chapter is something that you need to have a look over again. Okay, and the answers to these questions, they should be like this. They really do need to be snap on, because when it comes to an exam, when you're getting into that exam, you're going to be stressed, you're going to be worried, you're going to miss little pieces of information, you are going to make mistakes within this exam, unfortunately. But you're going to be able to make up for time by knowing things quicker. Okay. I set the pass mark for our mock paper for calcs at like 80%. You know, everybody knows that the GPHC changed their pass mark and it's less than 80% often, for calcs at least anyway. Now, the fact of the matter is, the reason why I set it so high was the point is when you get into the exam, realistically, you're going to perform worse than what you've performed in mocks. You're going to perform worse than how you perform at home. So if you're aiming for 80%, even if you fall to 70, hopefully you'll be okay. So that's the reason why that was so high. But always aim to do best, especially in calcs. If you can aim for 100%, if you're one of them students, go for it. Okay, let's move on. Ensure to complement your learning style, and to avoid complacency, I'd also add that in here. So for example, if you learn better in group revision, then go for it. If you've been doing group revision and that's not been working for you and knowledge isn't sticking, well then switch over to something different. Switch to individual learning. I had to do that in my final year. You know, I was revising in a group. I felt like it wasn't necessarily working for me. I went and I started revising alone. I was doing significantly better. I went from, you know, not passing in one mock to getting 80% in the real thing. So I think, you know, that was something I had to make that decision. I had to make that choice. And it wasn't nice because people, you know, people often in groups say, well, we benefited from your presence in a group. However, the mere fact is, you know, everybody's sitting their own exam. I'm not saying don't be a team player, don't help your friends, but ultimately, you know, you're doing the exam yourself and you need to make sure you pass. That's your first priority. If you learn, you know, if you've been learning from your own notes and you've gone through them several times and you're becoming complacent, well, go do a course somewhere. You know, it doesn't have to be this company, it could be any company. If you've done a course in this company and you've looked through your own notes and you still feel you're becoming complacent, do another course, you know. Discuss with colleagues, do something different basically is what I'm coming to. Make sure you do mock exams as well. Really, really important at this stage. Try and do at least 2. Make sure you set yourself up to achieve your goals in time. Aim to finish your revision maybe a week or so before, and literally just start flicking through things on the last week or so. Don't stress yourself out. Don't overwork yourself. Remember, it's a marathon. It's not a sprint. You need to get there. You need to get to this exam, and you need to cross that finish line. After that, you can chill. You can go out. You can enjoy the sun. You can sunbathe every day if you want to. So, in terms of exam prep, if you're not aware already of this webinar that Atif did in terms of preparing for the GPHC assessment, definitely something for you to look over. Okay, he did talk about different revision techniques as well and productivity techniques and tips. Excuse me. So definitely something useful and important for you to have at least looked over. Okay. So in terms of setting out a timetable, make sure you're covering all key areas when it comes to clinical. Please, please, please make sure you know what the heavyweight topics are and you have a good grasp on them. A potential approach for revision might be reading a section of the BNF, reading the OTC lecture notes, for example, and then maybe recapping your own notes that you've made, having a look through the infographics, then going on to the next topic, and then the next topic, rinsing and repeating really, just going through each topic, but making sure you're knocking out topics that you feel comfortable on. Calculations, make sure that you're comfortable with all 12 types of calculations, okay? Really, really important that you are aware of these. These are all pretty much going to come up. It's pretty much a given, okay? If you are weak on calculations or you just want a different way to revise yet again, we do have a fully online calculations revision course that you guys can attend if you would like to. Okay, not something that I'm going to push you towards per se, but it's there if you want it. Law, ethics, and miscellaneous. So follow the advice from today's session. Follow the advice from the law and ethics webinar as well. Very, very important that you do prepare early. Now, in terms of note creating, okay, so note creating is how I would define this as is covering new information and trying to summarize it. And it's not necessarily looking at your notes and creating condensed versions of your notes already. So new note creating, it should be done by, I would say, next weekend at the latest, and even then we're cutting it fine. Okay. Ideally, this should already be done, but it's not doom and gloom if it isn't done already. Next weekend is okay as well. Sit 2 mock exams under time conditions in a virtual learning environment if you can. Incredibly important. Can't stress this enough. There's no point somebody, I'm sure with our mock as well, I'm sure somebody's copied and pasted and sent all the questions around. People have done it with the videos, with our other content as well. It's understandable. Unfortunately, it doesn't help the company to, grow and expand and create better content and improve content continually, or continue on with charitable efforts as well per se. But nevertheless, I understand people do these things. Um, However, please do try and avoid it. But do try to set things in a timed conditions in a virtual learning environment, because the fact of the matter is that's the closest that you're going to get to the GPHC exam before the exam. Until you've been in that environment, until you've been in that situation, okay, it's going to be it's going to be difficult. Okay, it's going to be difficult to prepare yourself mentally. It's if somebody just gives you a copy of, or this is the Pharmacy Foundation's online mock for 2023. I've copied and pasted it all into Word, and they just give you that. Fair enough. However, it's not going to give you the reality of what it's like in the GPHC exam. So definitely try to avoid that, because there's only so many mocks that are out there, and ours is, I think, one of the very few that's quite competitively priced. And there's literally only 2 seats left for it anyway, so this isn't me trying to push to sell it as well. So don't forget to try the GPHC sample paper as well. Okay, it's completely free, available by the GPHC website. So definitely something that you want to be having a look at as well. Let's move on then to the GPHC frame feedback. So this is something, unfortunately, that often students haven't looked over, but it's incredibly important, because the fact of the matter is these are the learning points that the last year's students didn't pick up on really, that they didn't know quite enough about. So let's have a look at this. In terms of part 1, in terms of calculations then, candidates should check that each answer is practical and realistic, as this will help identify incorrect answers. So if you think that a patient is going to have a quarter tablet, in most situations, this isn't going to be correct, is it? So if you think, you know, one oral gel, is, uh, oral mucosal gel, for example, is going to last a patient a year. That's not practical, is it? How about preparing a foot bath in 40 liters of water? I've seen these answers before. Um, Recommending doses that are 10 times and even 100 times above the recommended limit. So just being practical, I mean, what have you seen in practice? You know, it's not very often that somebody's prescribed 2 grams of amoxicillin 3 times a day, is it? Or has somebody ever prescribed that for that matter? So just be practical. And amoxicillin is an easy example because you come across it a lot more often. But nevertheless, it's very similar principles. Okay. One thing where area where candidates didn't perform well was intravenous infusion rates. So candidates should consider all of the relevant information that is provided: duration of the infusion, the maximum concentration, and the maximum rate of infusion. Okay, so these particular pieces of information may be given, but they may also be arranged. They say this is the minimum, this is the maximum rate of infusion, and they're actually asking you to calculate for the minimum rate. But trust me, people do this every year. They'll calculate for the median rate because they'll try and figure out the difference between the two, or they'll calculate for the maximum rate simply because they're rushing. Okay, so really, really important you do take your time and you prepare to be 100% student when it comes to calcs, ideally, if you're good at calcs. If you're not so good at calcs, I think 70%, 80% is passable, hopefully for the exam. But really, really important that calcs is something that you can definitely get a grasp for well before the exam. Finally, candidates are expected to apply their underpinning knowledge and round at appropriate stages in pharmacy calculations. Okay, so round towards the end. Okay, if, for example, if a person is taking if the recommendation that you figured out is 2.1 tablets 3 times a day, and you're wanting to make a supply for 7 days, well, 2.1 tablets 3 times a day is going to be, what is that, 6.3? 6.3, and then if you multiply that by 7, well, you've calculated for over, haven't you then? 6.3 times 7, what's that? That's 42, 44, 44.2, I think, or 44.1. Obviously, the number that's actually going to be incorrect because you've oversupplied. Where you'd want to round is, well, if each dose is 2.1 tablets or capsules for that matter, well, it's basically it's 2, isn't it? So you'd want to be rounding down at that point. Making sure that you round at appropriate stages is incredibly important. Okay, so moving on then, what was the feedback for part 2? A lot more feedback points for part 2, as per usual. Areas where you could have done better, or last year's candidates could have done better. Red flags and referral criteria. Understanding the fact that, you know, if you're in community pharmacy, what are red flags? Because things are different if you're in community pharmacy versus general practice, of course. And then things are different if you're in A&E, for that matter. So understanding referral criteria is incredibly important. The time that medications should be administered, of course, to minimize any potential adverse effects or side effects for that matter. You know, statins, everybody knows ideally. You know, things such as simvastatin particularly should be given at night time. Other medicines that should be taken after meals. Good examples for this would be things like nitrofurantoin should be after meals. Medicines that should be on an empty stomach, such as flucloxacillin. Alendronic acid is probably another really good example for you guys to be aware of if you weren't already. Maximum daily dose of paracetamol. This is more age-related, weight-related. So if somebody's under 50 kilos, you'd reduce the dose. Understandably, under 12 years old, have a completely different dosing regime for paracetamol in comparison to adults. The use of medicines in breastfeeding and the management of minor ailments in breastfeeding. So typically you give a lot more self-care advice, but what medications should or should not be used is incredibly important for you guys to be aware of course. Analyzing prescriptions for validity, clarity, and supplying medicine safely, efficiently, and legally. Okay. This hopefully we've touched upon today. So hopefully you're aware of that to some extent or another. Knowing when to use acute versus chronic disease management guidelines. So if somebody comes in and they have a blood pressure of 190 over let's say 95 for argument's sake, or over 100. Now, if the person says, I've got chest pain, well, we're going to be worried about MI and we're wanting to rule that out. If the person says, I stopped taking my antihypertensive medicines 6 months ago, it was because I was depressed. They've got absolutely no cardiac symptoms whatsoever. So no chest pain, no chest tightness, no neck pain, no shoulder pain, no nausea, no shortness of breath, absolutely nothing. But the blood pressure is the same. Well, then we're going to look more towards the guidelines of hypertension, aren't we? We don't necessarily need to refer that person. Depending on what scenario you're in, you'd probably be more comfortable to do that if you're working in general practice. In my perspective, you'd probably want to review the patient quite soon after as well. They've taken their dose of antihypertensives and ensure that you've got enough safety netting in there as well. So hopefully that makes sense. It's one scenario, but depending upon the patient's previous history and presenting symptoms, it completely changes the guidelines that you'd be following. Common respiratory conditions. Unfortunately, this was an area of weakness for some reason. Asthma and COPD are very common. In terms of the respiratory chapter, incredibly important that you are aware of them. Familiarize yourself with resources commonly used in practice. Please make sure that you understand the layout of SMPCs if you've not had a chance to look over them already. You know, Control F is everybody's friend, but it's really, really important that you also do have an awareness anyway. Antimicrobial resistance and treatment choice is yet another point where students did not perform well. So this is the exam for yourselves. The results day is the 28th of July. You'll be sitting this exam. You're literally just what? 16 days away, just over 2 weeks. It's computer based, it's fit to sit. You can withdraw from the exam anytime up until the exam. Everybody gets a bit queasy. You can feel a little bit unwell on any exam day. I often did. But if you are genuinely unwell enough to continue with the exam, just withdraw. Okay. There's no point wasting an attempt if you're genuinely unwell. If you're somebody that suffers with migraines and you've developed a migraine, typically migraines don't necessarily recover very quickly. There's no point necessarily sitting the exam is there if you're genuinely not going to perform well. You can use an on-screen calculator or bring a calculator from the approved list for paper 1, of course. You can use a pen and paper for rough working, which is provided by the test center. There's no mobiles, of course, that you can use, or smart devices for that matter. You do also need to bring a valid ID, so a passport or a driving license. And finally, you've passed every single exam. Every single exam that you've done prior to this one, you've had to pass. You've been practicing for this exam not for the last year, but since year 1 of pharmacy, since undergrad. Everything's been building up to the exam. And the vast majority of people pass this exam as opposed to fail. And if you're on this cohort, if you're listening to this now, if you've watched the previous webinars that we've done, more likely than not that you're going to pass. 90% of the people that watch these webinars are fully engaged with the course, passed the exam last year. So I don't see why that can't be you, which is higher than the pass rate, thankfully, than a lot of universities. Because when people tend to pay for something directly, they tend to engage a lot more as well, from my experience. So that brings us to the end. We've ticked off all these topics over the last 10 months or so. Not 10 months, even 8-9 months even. It's been a journey. It's been excellent to have so many of you guys on board. Thank you so much for your time, due care, and attention. I know there was a few questions in the chat. I'll try and answer them in the WhatsApp group. Hopefully later on today. Thank you so much for everything. Thank you for coming along today as well. It's a massive good luck from me and the team at Pharmacy Foundations. Hopefully you smash this exam. Can't wait to have you guys as part of the profession, help growing the profession, help making you guys successful. I'm going to stop the recording and stopping the screen share now. Thank you so much, guys. You're all very welcome. Hopefully you can go out there and enjoy the weather. Hopefully you've had a good morning so far. Hopefully you've been working hard. I've been awake since 6:45 this morning, so I'm going to go out there and enjoy the sun a bit, hopefully. But hopefully you guys do have some time to chill out a little bit as well. Do definitely, take a rest breaks, go out there, absorb some vitamin D. You can always use the excuse that you need about 20 minutes of sunlight to get your appropriate amount of vitamin D. So make sure you get at least 20 minutes out there in the sun. But yeah, thank you so much for everything. Thank you so much for coming along. Good luck with everything. If there's anything else that I can do, please do let me know. You can even DM me if you want. I don't mind. Plenty of people do, and usually I send voice notes back. So if you're okay with listening to my voice, feel free to DM me.